This week we'll be meeting face-to-face to do a respiratory assessment on your patient. So make sure that you're watching this video and practicing your respiratory assessments. So I have Mr. Black here. He's going to be my patient. So I've come in, I've done my general survey, my safety check. Everything's working. I've gotten a set of vitals, and now I'm going to do to my head to toe. So I'm on the respiratory system right now, so I'm going to do my respiratory assessment. I'm going to make sure that my patient is comfortable before I even do any of my assessments, making sure they're not in any pain, because they're not going to want to do things for me if they are in pain. So I see that Mr. Black should be on 2 liters nasal prongs, and his nasal prongs are right here. So I'm going to place these back on my patient. So the way you want to do it is so that the prongs are pointing downwards, because you want it to go down the nostril and into the lungs. So I'm going to place it in, put them around the ears, not around the head like this. It goes in the nose, around the ears, and then we push this up so it secures it. I'm going to make sure that my patient's in a nice comfortable position. So it's a lot easier for our patients to breathe if they're in a semi-Fowler's or a high Fowler's position. So semi-Fowler's is in about this stage. High Fowler's is at a 90. I'm just going to bring my patient up a little bit. So when we do our respiratory assessment, we first look, then we listen, and then we feel, okay? So I'm going to look at the patient. I'm going to see his mucous membranes. Are they dry? I'm going to ask the patient some questions. So, Mr. Black, are you having any shortness of breath? Are you having any chest pain? Are you coughing up anything? So do you have a cough? Is it productive? Is it non-productive? If he says it's productive, I'm going to investigate more. So, Mr. Black, what color is your sputum that you're coughing up? So that you can get things like yellow, brown, green, white. Yellow and green are more of an infection. Brown could be old blood. Red could be fresh blood. So we want to get all that information. So I have my patient. I've asked him some questions. I'm going to go down to his chest. I'm going to make sure that his chest is rising and falling symmetrically. I'm going to ask if he has any pain in his chest. And then I'm going to go and listen. So I'm going to show you on here how to listen to your patient's chest. So we're going to listen to both the front and the back, and we're going to be going side to side. So getting your patient to take nice deep breaths in and out. And if you cannot hear them, encourage them to do it louder. So my stethoscope has obviously been cleaned. I'm going to place it in to my ears. Remember that you always want to make sure that you're on the right side. So there is a little dot here that shows you which side is correct. So if you can hear it, it's good. If you have it the wrong way, you're not going to be able to hear it. So make sure that you're putting it on the correct side. Okay, so I'm going to start. I'm going to have 6 areas that I'm going to assess this patient's chest. So one is up here on the right upper lobe. Take a nice deep breath in and out. And I'm going to go and I'm going to put it to the other side so that I'm making sure that I'm listening to each side. In and out. Then I'm going to go down, in and out, over, because I'm comparing the two. In and out. And then I'm going to go to the sides. In and out, and in and out. So these are your upper, your mid, and your lower. Okay, I'm going to do it to the back. If the patient can sit up, get them to sit up so that you can listen to the back. So again, I'm going to go from side to side, in and out, in I hear any abnormal findings, I'm going to make sure that I document it. I'm also going to do a respiration rate. So this is where I'm going to get the patient to just put his hand over his chest. I'm going to say that I'm going to be checking his pulse. This is a great way to check his pulse at the same time. And so that when I tell him that, he's not going to, his breathing pattern won't change because he knows that I'm staring at it. So, Mr. Black, I'm just going to check your pulse here, and I'm going to look at one full respiration. One full respiration is in and out. So the chest expands and relaxes, and that's one resp. Okay, and I would count it for 30 seconds if it's regular. If it's irregular, I'm going to count for 1 full minute. Okay. Again, Mr. Black is on oxygen, so I want to be making sure that his oxygen is correct and there's no kinking. Patient's actually getting some oxygen, and I'm going to make sure that he's on the correct amount. Okay. You might also see things like facial masks. So these nasal prongs can be put on your patient from 1 to 6 liters, and preferably around 5. If you're going to go any higher, you want to put them on a mask, because this is, if you have them too high, it's first of all going to be blowing so much oxygen up their nose and be uncomfortable, and they won't be getting the amount they need. So it's just going to be blowing everywhere. So that's when we start to put a mask on, and then it's more control, and then the patient is going to be getting all that nice fresh oxygen. Again, your patient might start to get some dryness or bleeding in his nostril areas from having the constant air. So you can put some Vaseline, or we can humidify the air to make it a little bit more comfortable.